Hello dear student, in previous class I have discussed about glaucoma and have told you that glaucoma and myasthenia gravis, that are the two important terms that I have used in previous classes in sympathomimetic, parasympathomimetic, sympatholytic, parasympatholytic, etc. And I have told you that I will discuss about that myasthenia gravis and glaucoma in a separate video. In glaucoma, that I have already discussed in previous classes, go and check it out into the description where I have given about the glaucoma what I have discussed in previous class. Go and check it out, that previous video link is given into the description. Today we are going to discuss about the second term, that was myasthenia gravis. So don't waste the time, let's get into that video of myasthenia gravis. First, we have to know what are the reason and why that myasthenia gravis generally takes place, and what are the definition of myasthenia gravis. So, myasthenia gravis is a chronic autoimmune disease. We know disease can be two types. One is chronic and acute. That myasthenia gravis is a chronic disease, that is an autoimmune disease. Now, before going into that myasthenia gravis, we have to know what is autoimmune. To know that autoimmune, we have to know that immunity. We know what are immunity. Immunity is the power of our own body to fight against a particular antigen that are going to do damage to our body, which are generally entered from outside. We call as toxic unwanted foreign bodies. To fight against them, our body generally generates some protein molecules that are antibody. That antigen and antibody are going to bind with each other, and that antibody is going to destroy that antigen activity and treat that disease that is caused by antigen. But sometimes what happens in our body on immunity, so hyperactivity or hyper alertness, what it will happen, it is going to start synchronizing that all the particle or all the chemical whatever is present in our body, they are toxic and they are unwanted, they can cause diseases. So they started to misunderstand all that particles or on that all that bodies that are going to enter in our body. So in case what it will happen, it is going to activate its immune system and going to destroy that useful material that is very important for our body. For that destroyment of that important protein molecule that is already present in our body and very important for pursuing different work or different function, when our immunity system is started to react against that own system, that is called as hyper reactivity immunity or autoimmunity. Like that, one example is myasthenia gravis. So myasthenia gravis is also an example of chronic disease, that is an chronic autoimmune disease. So in autoimmune disease, I have told you that it started to overreact against its own system or against their own material or on particle that is important to our body. In this case of myasthenia gravis, our immunity system is going to show hyperactivation or hyper immunity against a particular molecule. In this case, they are going to show their action against a antibody that is acetylcholine receptor protein. So in this case of autoimmune disease, what is going to place in myasthenia gravis? In myasthenia gravis, our immunity is showing greater reaction or hyper reaction and going to think our own acetylcholine receptor protein, which is very important for smooth muscle, thinking as an foreign antigen or toxic antigen. So our immune system started to produce antibody against that acetylcholine receptor protein and going to bind antibody acetylcholine receptor protein and going to decrease the action or synthesis of acetylcholine receptor protein in our body, that will lead to the pain in neuromuscular junction. It will lead to the neuromuscular junction pain. That neuromuscular junction pain, according to the decrease or destroyment of acetylcholine receptor protein due to the autoimmunity of our body, it can lead to the impairment of smooth muscle, whatever smooth muscle which are present into our body. That smooth muscle is started to misbehave, or is started to doing misbehave or weakness. It leads to the smooth muscle fatigue, and sometimes it leads to the deterioration of smooth muscle. And that deterioration of smooth muscle due to the autoimmunity against acetylcholine receptor protein in our body, and autoimmune disease as a chronic that generally showed in our body, that is myasthenia gravis. So it is a simple introduction about myasthenia gravis. Now we are going to discuss about the different symptoms by which we can understand that one person or one patient is generally suffering from this particular disease, that is myasthenia gravis. These are the symptoms by which you can easily understand that, or you can estimate that one person is suffering from myasthenia gravis, or that patient may be affected by autoimmune disease, that is myasthenia gravis. What are the symptoms? Let's go into that symptoms. First one is fatigue. That fatigue will lead to the weakness or urge of not doing any work. That means that person will be idle, so you will be unable to pursue any work because of the fatigueness and weakness or deterioration of smooth muscle wherever the smooth muscle is present in our body. Sometimes dropping of eyelids due to the myasthenia gravis in eye smooth muscle or ocular smooth muscle. Sometimes that eyelids is started to drop automatically due to the impairment or fatigue or weakness of ocular smooth muscle present in our eye. Eyelids started to drop out. From that also you can understand that one patient may be affected by myasthenia gravis. The next is dysarthria. What is dysarthria mean? Dysarthria means difficulty in speaking. We all know to speak we generally use our mouth, and to speak also different smooth muscle are present in our oral region which helps us generally in speaking. In case of myasthenia gravis, due to the weakness or fatigue of smooth muscle present in our mouth or oral system, sometimes that patient is suffering from difficulty in speaking. That in medical term is called as dysarthria. That also sometimes indicates that that person may be affected by myasthenia gravis in oral region. Next one is dysphagia. What is dysphagia? Dysphagia means difficulty in swallowing and chewing. We all know to swallow the liquid orals and to chew the solid food, we have to use our oral. So that oral smooth muscle is also help in chewing and swallowing foods. So due to the fatigueness of that muscle, it sometimes causes difficulty in swallowing and chewing. That difficulty in swallowing and chewing is called in medical term dysphagia, and due to its difficulty in speaking in a person can leads to the dysarthria. So dysarthria and dysphagia symptom can indicate that that specific person is suffering from myasthenia gravis, and sometimes it can cause respiratory weakness, respiratory weakness or suffering due to the loss of or deterioration of fatigue or weakness of smooth muscle. That person feel very uncomfortable to do any work. If he is able to do any work also, he felt respiratory weakness or problem, and he faced some breathing problem when he is doing even a simple work due to the deterioration of smooth muscle. So whenever one person is suffering from fatigue or weakness of smooth muscle and not having interest in doing work, their eyelids start dropping due to the inactivation or fatigueness in eye or ocular smooth muscle. According to the activity or inactivity of smooth muscle in mouth section, that can cause difficulty in chewing and swallowing food, that called as dysphagia. That can lead to also the difficulty in speaking, that is called dysarthria. And due to the lack of smooth muscle activity, whenever a person is doing less work also, he can feel respiratory weakness or breathing problem. Whenever you can see all that symptom in a particular person, you can estimate that that specific person is suffering or may suffering from myasthenia gravis. So whenever you are seeing all that symptoms that I've already discussed in that slide in a particular person, you can guess or you can tell that one person or that particular person may be affected by myasthenia gravis. But to be sure that really is suffering from myasthenia gravis, so that we can further pursue into the treatment of that particular person, we have to physically or we have to scientifically prove or diagnose that that person is really suffering from that myasthenia gravis only, and we have to find out the real reason of that myasthenia gravis also, that it is generalized or it is due to the fatigueness of ocular muscle, or just only for face muscle, or just in general all over the smooth muscle what are present in our body. What is the diagnosis stage? That is called as serum acetylcholine receptor test. By that you can understand in our serum or blood how much of acetylcholine receptor are there. If that amount is less than the normal amount, then you can tell that that person is suffering from myasthenia gravis. So the diagnosis test for myasthenia gravis is serum acetylcholine receptor test. So that is the diagnosis process of proving that particular patient is generally and simply suffering from that myasthenia gravis. Then we can pursue with the treatment of myasthenia gravis. So now we are going to discuss about the possible treatment for myasthenia gravis. So from drug also we can treat, and sometimes from therapy also we can treat myasthenia gravis depending upon the stages of which that person is suffering from that myasthenia gravis. So what are the drugs that going to be used against? That is cholinergic antagonist or acetylcholine antagonist. Example is neostigmine. Then the drug that we also can be used to treat myasthenia gravis, that is corticosteroid. Example prednisolone. We also can be used non-steroidal anti-inflammatory drugs or immunosuppressant that will suppress the immunity to treat that autoimmunity problem. By that it can treat myasthenia gravis. Example is methotrexate and cyclosporine. So what are the drugs that can be used to treat myasthenia gravis? That is cholinergic receptor antagonist or acetylcholine receptor antagonist. Example is neostigmine. Then we can use corticosteroid. Example is prednisolone. That we can use also NSAIDs or non-steroidal anti-inflammatory disease. Or we also can use a immunodepressant or immunosuppressant drug that is going to suppress the immunity system so it can't show autoimmunity and can treat myasthenia gravis. Example is methotrexate and cyclosporine. Sometime for the rapid recovery, rapid therapy is also taking, that is called intravascular immunoglobulin therapy. That also can be taken to treat myasthenia gravis because it is involved in smooth muscle, and sometimes it can be treated by use thymectomy. In case of enlargement of thymic gland in smooth muscle. So myasthenia gravis can be treated by using drug and by taking therapy also we can treat. In drug we can take cholinergic antagonist receptor like neostigmine, corticosteroid drugs like prednisolone, NSAIDs or immunosuppressant drugs like methotrexate and cyclosporines. And in case of therapy treatment we can take intravascular globulin therapy, or we can take thymectomy surgical process if that involves in enlargement of thymic gland in smooth muscle. So these are the possible treatment for myasthenia gravis. At last we are going to discuss about the type of myasthenia gravis. According to the where that smooth muscle is present, we can classify the myasthenia gravis. First one is generalized. From that name only you can understand in full body wherever smooth muscle is present, that smooth muscle is going to show weakness due to that autoimmunity and cause that myasthenia gravis, that is called in generalized myasthenia gravis. Second one is ocular myasthenia gravis. From that name only you can understand whenever weakness or fatigue is shown in eye smooth muscle, it can lead to the dropping of eyelids. That ocular smooth muscle inactivity or weakness is called as ocular myasthenia gravis. Then according to the age person, also you can classify that myasthenia gravis. That is first one congenital. Second one is juvenile. Third one is neonatal. So the type of myasthenia gravis can be classified according to the wherever smooth muscle is present. According to that, classify is generalized myasthenia gravis because of smooth muscle wherever it is present in our body. That weakness it can cause generalized myasthenia gravis. And second one is when that high eyelids or eye smooth muscle is going to show fatigueness due to the autoimmunity, it can cause eye dropping or eyelids dropping. It is called as ocular myasthenia gravis. Sometimes that myasthenia gravis can be classified according to the patient age. If it is pursuing into some specific age, that age group patient also, myasthenia gravis can be classified into three parts. One is congenital myasthenia gravis, second one is juvenile myasthenia gravis, third one is neonatal myasthenia gravis. So by that I have finished up, or I have discussed about the myasthenia gravis, about the definition, about the symptoms, what are the reasons for the myasthenia gravis, what are the symptoms by which you can understand that people may affected by myasthenia gravis. Then we have to prove it by diagnosis process. There we have studied about serum acetylcholine receptor test. Then we have discussed about the different drug treatment that can be used, like cholinergic antagonist, neostigmine, NSAIDs or immunodepressant or suppressant like methotrexate and cyclosporine. And third one we have studied about corticosteroid. In the corticosteroid we have studied the example of prednisolone. By therapy also you can do, because it is related to illness of smooth muscle therapy. It leads to IVG, that is called intravascular immunoglobulin test, and sometimes it can be treated also by doing thymectomy, a surgical process in case of enlargement of thymic gland in smooth muscle. And at last we have discussed about the types of myasthenia gravis according to the place of smooth muscle. If it is general, that is generalized. If it is in eyelids, then it is called ocular myasthenia gravis. And sometimes about the person who is going to attacked by that myasthenia gravis, according to their age also, myasthenia gravis is classified, can be classified into three types: congenital myasthenia gravis, juvenile myasthenia gravis, and neonatal myasthenia gravis. So that's all about myasthenia gravis. Please go and check glaucoma in the previous class, and today check about myasthenia gravis. From next class I am going to discuss about a new topic called autocoids. But today it's enough. Go and check myasthenia gravis and glaucoma that I have discussed into the previous class. That link is already given in the below. And next class we are going to discuss about the topic, a new topic, that is autocoid. Thank you.